Hundreds of hospitals will become extinct unless they improve their patient outcomes. Improving outcomes means improving processes, both process design and process compliance. But who can afford to focus on every step of every process? The software application process measure identifies the process steps with the greatest potential for outcome improvement based on how often each step is missed or misperformed and its impact on outcomes. Process measure has been in use for a year at a hospital that has used it to obtain recertification as a regional stroke center. The inspectors were impressed with the use of process measure to improve outcomes for stroke patients. The hospital says that process measure is easy to use and that the ease with which performance graphs can be obtained is truly impressive. The hospital adds, "We're excited about spreading the use of this tool to other acute care situations in the hospital." Our team includes 2 attorneys to keep me on the straight and narrow, a healthcare systems engineer, and a geek who gives orders to machines that do what he says, but not always what he means. That was it.
Thank you, Eric. So you said this is being tested for stroke right now. So as the disease state changes, do you have to change the process, like the steps in the process or the software for different diseases, or does it stay standardized for across various disease states?
Great question. Thank you very much. First of all, I want to introduce Devesh Dahali from Alabama. He is one of the members of the team there, the Director of Health Systems Engineering at Southeast Health. And I have met him today for the first time in person, even though I've been talking to him for 5.5 years. Back to your question, the program, so a hospital defines its processes within this program. So you can define any process you want for any situation you want. It's completely customizable. Does that answer the question? Okay, good.
I'm curious, when you try to solve problems within a hospital and they're not usually receptive to, here, we want to correct your errors for you. How do you get input of the information that the machine is sifting through to give you the answers? Is it, in most healthcare that I've run into, it's human input. Is that what this is? And how do you get over the hump of, we don't make mistakes here, that's at the hospital down the street?
Thank you, great question. I'll let Devesh answer that since he actually does it.
Devesh Dahali, they are actually the users of the software that we have co-created. And the way things work in healthcare, being in the midst of it, is that oftentimes we are held accountable to the overall outcome. For example, one of the measures that you're all aware of in the stroke world would be the growth in needle times for patients receiving thrombolytics. So when we evaluate an outcome, typically teams come together and say, how did we do with regard to this particular patient? And when we do that evaluation, it's oftentimes very random in nature. What went well, what did not go well, and does not have a very good structure. So our intent here was to actually establish that structure, but also make it measurable. And the structure really comes from people who are knowledgeable about the process. For example, it could be somebody as simple as saying, did I identify the stroke in a timely manner? AKA called the code stroke, which gets announced across the whole hospital. It could be something which is in the nurse's realm with regard to from the time that the pharmacist actually delivered that TPA, did the nurse actually administer it within a short period of time? These are two examples of the questions that we would include in terms of the steps that are followed from the time that the need is identified to the time that we get measured with regard to this. So where do the inputs come from? They come from the clinical team, typically. And what do we do with it? We arrange it in such a way that that captured information then gives us insights into which steps are actually causing the biggest impact.
Thank you, Devesh. Thank you.